Hi, everyone. Like Dr. Hall said, my name is Sam. I'm the social worker for the HD clinic here at Rush. I'm relatively new to the clinic as of June, but I've been at Rush for a while. So I wanted to also talk about what social workers do in the clinic. A lot of times it's people's first time working with a social worker when they see me. So I wanted to get everyone up to speed on what we can provide. Today I was asked to talk about caregiver resources and support. And as you've heard from many of the providers prior to me, caregivers are an integral part of the care team, and it's very important that we work with you and we support you so that way your loved ones are healthy and we can take as best care of them as we can. So I like to start off some of my presentations with breathing and grounding exercises. It helps me relax a little, and I think it's great for the audience to practice, and you can use this later as well. So this is a 4-7-8 breathing. It's very popular if you haven't heard of it, but we'll do 2 rounds together. If you have any breathing difficulties already, you don't have to participate, or you can just modify it so it's most comfortable for you. But you'll breathe in for 4 seconds through your nose, hold for 7, and then release for 8. So we'll do this together. Breathe in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and release. 2, 3, 4, 5, 6, 7, 8. One more time. Breathe in. 2, 3, 4, hold. 2, 3, 4, 5, 6, 7, and release. 2, 3, 4, 5, 6, 7, 8. Okay. So those are just some of the techniques, and I think Dr. Anderson mentioned them some as well, but just to help get you into the present and kind of get your body relaxed and your mind relaxed as well. So we like to use these a lot, and we can talk more about them one-on-one if you're interested. So there was an AARP study done. They surveyed caregivers in 2015, and they asked caregivers what they wanted to learn more about or what they wanted more support on. And so there were 4 main areas that caregivers wanted help with. They wanted to help make a safe home for their loved ones so that way they could age in place and not be moved to a facility. They wanted help managing personal stress because, as we know, caregiving can be a lot for one person to take on. They wanted help with end-of-life decisions, and they wanted help managing some challenging behaviors. And so Dr. Hall and Dr. Anderson talked a lot about that already. Caregivers take on a lot in these roles, and it can affect them in various areas of their lives. So there's physical, emotional, and financial, and all of these stressors, strains, and pressures go up the longer you're caring for someone. So a year as compared to 10 years, the more hours you put in per week caring for someone. If you have to help provide some of the nursing needs, so hygiene, eating, getting ready in the morning, transferring, those create a little bit more stress. And then if you feel like there was no choice in having to provide care, which sometimes there's not, that can add a lot more stress. And then the closer your relationship is with the person you're providing care for. So it might be different for an aunt as compared to your child. But in these different areas, caregivers, the physical strain, so it could be very clear cut, like helping someone transfer, that can be hard on your back. Caregivers are more likely to get short-term and long-term illnesses like the flu or chronic conditions. They experience emotional distress. Sometimes it can be very isolating as a caregiver. That's why we have support groups to try and help with some of that. And then the financial pressure as well. Specifically, if you're caregiving for more hours a week and you may have to quit your job or take time off, that can affect your income. So here's a little assessment, and you can answer these to yourself in your head for now. But it can be difficult to recognize when caregiving starts to be stressful, and it can also be hard to be honest with ourselves when it's getting stressful. But when caregivers are stressed, more mistakes can be made. and they just have more difficulty providing that wonderful care. So here are some questions. So feeling angry or sad, feeling like it's more than you can handle, which is absolutely true. Caregiving is not just for one person, it's a team effort. Feeling like you don't have time for yourself, and we'll get into that more. Sleeping too much or too little, having trouble eating or eating too much, and then losing interest in things you used to enjoy. So self-care has been a hot topic to talk about, and I think it's wonderful to do that, and it's also very important to remember that taking care of yourself is not just something else on your to-do list, and that we need to involve a lot of other folks when we want to take care of ourselves. So this includes healthy eating, getting enough sleep, making sure you exercise, even if that's a walk around the block, following up with your own medical provider so that way your health isn't deteriorating as well. We have many support groups and counseling options. Me time, this is my dog Luke. That's my me time. We go on walks so we get our exercise in, and he's always very positive with me, so I appreciate that. And then this big one, which has come up again in the other presentations, ask for help. We can't help you if we don't know what's going on, and so the more you can communicate with us, the more we can come up with solutions to what's happening. In the front, there were a couple different worksheets out there. If you didn't grab them, that's all right. There's plenty more if you'd like some, but I'll just read the titles and read a little bit into it. So one is your lifestyle causing you stress? They have some negative self-care behaviors, and those could include using tobacco products, drinking a lot of coffee, which I think many of us are guilty of, drinking alcohol, angry outbursts, watching too much television. So those are some ways we might cope with the stress, but they're not always the healthiest for us. They also have some positive self-care behaviors, which include engaging in physical activity, so walking your dog counts, getting lots of sleep, maintaining a sense of humor, play, and rewarding yourself for your accomplishments, which I think many of us miss that. There's also a self-care assessment, and this one's a little bit longer. It's 2 pages. And this one I actually did when I was in social work school, and I found it to be very helpful at the time, and I still keep it in mind today. But they have different areas to review to take care of yourself. So physical self-care, that's pretty obvious. We've talked about that. Psychological self-care. This can be taking day trips, make time away from electronics, write in a journal, read literature that's unrelated to work. Emotional self-care, spend time with others whose company I enjoy, reread favorite books, allow myself to cry, and find things that make me laugh. There's also spiritual self-care, which I find very important. Make time for reflection, spend time in nature, find a spiritual community, pray, meditate, sing. And then relationship self-care, so schedule regular dates with your partner or spouse, make time to reply to personal emails and letters, and then ask for help when I need it. So again, that one's coming up. And then there's also a section for workplace and professional self-care, but you can read a little bit more about these later, and then you can rank yourself, and there's a little score, so if you're into that, that's what that's there for. And then there's also a maintenance and self-care plan worksheet. And this is something that I can be more helpful with one-on-one, but if you're looking to make more of these changes embedded in your life, this is just a more detailed worksheet, and I can kind of walk you through those processes as well. So back to what social workers do, we address non-medical barriers to health. We can help with caregivers, homemakers, family members can be paid caregivers, long-term care, insurance, transportation, connecting with other providers. So that may be moving all your care to Rush or moving your care outside of Rush if you're finding a PCP, if you need a therapist, if you're looking for home health companies. Again, the behavior modification, that was brought up already. mental health support, which I'll talk about a little more, and then advanced directive. So out at the front as well, there's a healthcare power of attorney form. You probably can't see it, but it looks like this. It has a little barcode on top. This is Rush's form. So if you want to take it and talk it over with your family and friends and bring it back to us, Krista and I or Dr. Hall can help you complete it if you have any questions. But those are really important so that way family members know what they would like in the event that something happens. And along those lines, we also have the 5 wishes packet. And this is something I can go over more in depth with folks individually. We ran out this morning, but we can order some more and get those to people if you need it. But the 5 wishes are the person I want to make care decisions for me when I can't, the kind of medical treatment I want or don't want, how comfortable I want to be, how I want people to treat me, and what I want my loved ones to know. So these are really difficult conversations to have, as many of you know already. But it's important to write down what you or what your loved one wants ahead of time, so that way it's easier for the folks who are taking care of you to make those decisions, knowing that they'll align with your values. And that goes with end-of-life decisions. And then also all the care management services we would provide for patients, I can also help with for caregivers. And a few other things that were out there. The crisis template, this is from HDSA. I think it goes well along with the cards, but they just talk a little bit about if something were to happen, if you're walking around, people have these so that way they know what's going on and who your doctor is. So those are out in the front too. And then getting more into mental health, Rush has a whole host of mental health options for folks. So we have individual counseling that could be with some of our psychologists in the clinic, but also other social workers here. We have a general emotional wellness group for caregivers, as well as our HD specific one that I will start running in 2 weekends. So the 26th, which is also a Saturday, it will be here in the tower if you're interested. And HDSA also has a lot of wonderful online support groups, and you can ask Emily Zivin, our social worker from the chapter, more about those. And we have a caregiver initiative, Rush Generations programming. Those were all those flyers out there, but they have lots of lectures and workshops that you can attend. So mental health and depression in older adults and caregivers, the sandwich generation, caregiving for children and parents, different things like that. And then that self-care wellness plan. So those were the worksheets that were out there that I explained a little earlier. We can talk more about that together and kind of come up with a plan if you need someone to bounce ideas off of besides family and friends, so a third party. And that's the end of my presentation, but I just want to say that we really appreciate our caregivers, and we want to make sure that you're healthy and well supported just as much as our patients here at Rush, because you're super important to our care team as a whole, and we really appreciate you. Thank you. Oh, questions? If you have any questions, you can also email me or call me. I have my cards out front.